Hey guys, welcome back to the channel. This is Side Dental Vlogs, and today's video I'll be talking about periapical abscess. How do we treat a case of root canal if the patient is having abscess or if there was draining sinus from the region, any tooth like 3646. So we are going to talk about the details. So why there is abscess? So basically it is due to there is an entrance examination question, which is the most common organism which is causing dental abscess, or which is the most common organism which is causing dental caries. So the main causative organism is Streptococcus mutans, which is responsible for all the cavities in your teeth, and the abscess formation is due to different bacteria. It is due to Staphylococcus aureus and Streptococcus pyogenes. So these are the two main causes of bacterial production: increased bacterial production, increased food decomposition, and increased abscess formation. And there are many other reasons for abscess formation, like suppose any tooth, suppose you have caries is there and you are not getting it treated on time. So as the days goes by and as the years pass by without doing your restoration, the tooth initially goes into any kind of trauma, like whatever cold food you are taking, whatever food stuff you are taking, it's getting accumulated, and those are acted upon by the bacteria, and from there the radicular and coronal pulp is getting infected, periapical tissue is getting infected, and from there we get a abscess. Eventually the patient comes to the dental clinic for treatment. Now when we start the root canal treatment of the patient, however patients we are getting, we should always treat the root canal abscess cases with a lot of patience. Certainly we should not jump into the obturation part of it, right? Because if you obturate a patient with abscess, root canal, even if you have done a very good BMP, the chances of failure are very high at the later stages. Maybe after a year or so, the tooth may get reinfected again. So you have to wait minimum. What I do is I give minimum 4 to 5 appointments for an abscess case. So initially, whenever the patient comes to the clinic, we start the root canal, we do the BMP, we find out the working length. So always remember, first day what I do is, like whenever there is a huge abscess or any swelling, I give a open dressing on for few, like if the patient comes in the morning, so for few hours, for 5 to 6 hours, I give a open dressing to the patient. So that way what happens is all the pus which is there, which is accumulated in the canals, it comes out. However much irrigation we do, but still there is some amount of abscess, some amount of pus which is still getting discharged from the periapical area of the tooth, and it oozes out from the tooth wherever you have done the access opening. So I won't recommend to leave it for 24 hours, but initially if it's possible for you, give an open dressing for 4 to 5 hours. Suppose you do the RCT in the morning and then you just irrigate nicely in the evening and give a closed dressing. So that setup, like initially it's very difficult, because if you are having a new dental clinic, the patient won't be turning up to you for the second time on the same day itself. But still what I try to do is, even if I do the access opening in the evening, I make sure that in the next morning patient is going to come. Suppose the patient is not going to come, he is coming from a far off place. So in those cases, we have to give a lot more time to the BMP, on the initial BMP what you are doing on the patients. So whatever BMP you are doing on the initial day, it has to be done complete, like complete BMP of the tooth, like 4% 25 or 4% 6% 20, till whatever preparation you are doing. So if you don't know the meaning of 4% 6%, you can watch my video on Instagram, which I think I have already uploaded, and you can also watch this same video in my YouTube channel, what is 2% 4% 6% in RCT. And after preparation you can give nice saline, clean it, but I won't recommend to give sodium hypochlorite on the first day itself, because that may produce some kind of periapical infection or periapical irritation on the first day itself. So usually I give chlorhexidine and whatever intracanal medicaments are there on the second appointment of my RCT. Now the case selection is very important. So you have to take a prior IOP of the tooth, and at that time if you find like any kind of there is involvement of the furcation area, or if there is a lot of root resorption, or the bone which is there surrounding the tooth, it has got resorbed, so better to remove the tooth in those kind of cases. But if you are going to take up the case and if the tooth is really important, then what you have to do is, you I would suggest you to give intracanal medicaments on the second day of the obturated tooth, of the root canal treated tooth. Second means second appointment. So what I usually prefer, initially I used to, what is the common thing, common materials like RC Cal is available, Avu Cal is available. Then I found out a very good material. It's a little bit costly and not easily available. That is UltraCal Abscess. So what's the difference between these two? The pH of UltraCal Abscess is very high. It's around 12 to 14, I think. So highly alkaline. So it reduces the alkaline environment of the pus, which is present in the tooth, particularly the infected tooth. It reduces drastically the infection. On the third appointment, you can see the magic. And leave the intracanal medicament for at least 4 to 5 days before really acting upon. Now don't jump into a hurry, right? कि आपने कर दिया root canal, pain gone, and again you did the obturation last day. What I usually prefer is I do the obturation, even I skip the obturation in the next appointment. I again give calcium hydroxide on the third appointment, remove the old calcium hydroxide, put a new one. On the fourth one, I give a really good dressing, and then on the last appointment I give the obturation. So that way I ensure that the tooth is not gonna reinfect again, and I have seen very good results, like patient coming back to me after 6-7 years, and the same tooth when I take the IOPA, really nice results, no periapical infection, tooth is fine, patient is able to eat and do everything. So these are the few tips which I would like to share with you. If you have not followed me on Instagram, Sai_dental is my Instagram ID. You can go and follow me there, and you can subscribe to this channel as well if you like the content. Take care, have a very good day. We'll come up with more videos. Not getting time actually. Take care, bye.